Hey everybody, Dr. Rayner here.
Dr. Brandon Nutt.
Great to be here again. This is episode 2. So today's topic, we're going to be going through something near and dear to us: concussion screening, and really how do we take care of the brain. We see a lot of this in our clinic. We both played hockey, lacrosse. How many concussions did you have playing?
I think really one major one is really the only one that I can tell that I was Bambi legged, full on concussed. But there had to be, I don't know, 100 times where I came back to the bench going something smells weird, or fogginess, or there's a taste in my mouth, or something that just was not right. And there's probably been over 100 of those.
Yeah, I remember I got one documented concussion. Might have had more, probably. I don't know. Heck, anytime you get body checked, there could be a whiplash and some mild concussion. But
if I knew those things were potential, symptoms of a concussion, I might have said something. But since it didn't even cross my mind that a weird metallic taste in my mouth, which nowadays if I think man, I hope my kid would tell me if they had a weird metallic taste in their mouth, that's a potential symptom people with a brain bleed might have from cerebrospinal fluid.
Yeah.
But
might be a warning sign.
It might be a warning sign. But and if it gives anyone peace about this, I've probably had 100 of those, and knock on wood, I think I've turned out okay. It's I was, did pretty good in school and have a mostly functional brain, I think.
So, what did you do any baseline testing back then?
God, no.
There's no baseline testing. So, this isn't really to critique baseline testing, because it's critical. You go back 2 decades ago and it was non-existent. But knowing that there's tons of research that's been out for 15, 20 years about things that people can't fake, that give you more sensitive information on testing, and not necessarily that time intensive. Some basic eye tests, some posture tests and sway patterns, and your kid can't fake it. This should be every baseline test. So let's go through, what do we think are some of the shortcomings with the current baseline testing?
The current baseline testing, number one, in most youth sports, is still nothing. Is just, and the education on it of what might be and what should be perceived as a concussion symptom are still pretty vaguely understood. I think we can all see the kid who is all really loosey-goosey, falling all over the place, going back to the bench or going back to the, trying to stand up and falling back over. Those are major symptoms and things that people should be looking at that should say, wow, that kid needs to be tested. But when it comes to pre-season testing, a lot of people don't even think about it, number one, but it's becoming more and more common for people to be going, you know what, I don't think I want my kid playing soccer unless I know I can have an accurate, something objectively saying they have a concussion. And at this point, there's basically nothing in most sports. Now, what there is...
What is there? So we have kids come into our office with their parents, and their parents oh no, they did this testing, they're covered. What often are those, and why are those are still very insufficient?
Typically, those are tests, neurological tests that are done on paper, looking at more neurocognitive functions. So can you tell what time it is on a clock? Can you go from point A to B? Can you go from point A to 1? B to 2? Can you kind of go around the almost like a maze finding game to try to find the numbers, and they measure how long it takes you to do that, and then they do that 3 times, and then all of a sudden in the season, if they think you have a head injury, they have you do it again 3 times, and if your time is slower, they consider that there might be a concussion. The trail making test is kind of your typical test for that. Now, that's part of the impact test, and there's SCAT testing as well.
And then too, the studies looking at, what is it, after 9th grade, the dependability of those tests. Basically, kids learn how to kind of fudge the numbers.
Yeah.
So if they do get hit, they can still stay on the field, even though there's, potentially the performance would be less.
Yeah, I had a football player who was a Division I football player, and it was a joke between him and his teammates because I was treating him for a concussion, and he was telling me how the preseason testing is kind of a joke because they intentionally do so poorly, so that if they do get a concussion, and it's kind of expected. That's the thing. It's like expected throughout the team. Hey, everybody, nudge, nudge. Like, let's do really good on these tests and try to fudge the numbers a little bit. Don't be your best. Don't be your fastest on that because, and there's a couple other things wrong with that type of testing. But, after hearing professional athletes and college athletes say that they kind of make a joke about it and to try to not do it well.
Because that's not, the college athlete came in and said that. We also work with a decent amount of like professional athletes in their career and trying to just help rehab some brain things that are going on post career. And they told us the same thing to purposely perform somewhat, suboptimal on that first test. So your baseline doesn't have to shift when you get concussed. Like, oh no, that's how you were before the season started, which these are our highest level of athletes. And we, growing up and idolizing, certain pro sports, you just think they have the best doctors, the best care, and the best oversight, and you start kind of seeing the kinks in the armor, and there's areas to do better.
Yeah, it's funny you say that because I was talking to the mom of an NHL hockey player today, and she was telling me about her son's injury going on right now. He's playing through it, and it's just interesting because it's like, you think they're getting the best, and a lot of times it's up to them to still go find the best provider they can get. A lot of them, the professional sports are, what was it? A local team wanted us to be like the official team chiropractor, but we had to pay them.
Yeah, to be associated with them, which
is like, are you crazy?
So it's sometimes even to pay for hire. And then on top of it, their doctors, if you are being sought out, you want to also make sure you're keeping the establishment of that business happy, because it is ultimately a business. And so you kind of, toe a line sometimes, especially if you have an athlete wanting to get back out.
The other thing wrong, I would say, with the testing is those test scores could be, could be different from day to day, even in a non-concussed athlete. The time of day that you do that testing, especially on a teenager, like we know that the teenage brain.
3:00 after you're tired from school and you're coming home and napping and testing, not a good time.
Probably not. How about 7 a.m? Probably not. I think so if they're doing a test at 7 a.m, but then they're getting concussed on Friday Night Lights and they're doing the test at 8:30, 10 o'clock at night, it's like after a full day of school and after going to, getting ready for a football game and all that mental fatigue could be for a lot of reasons outside of concussion. So there's a lot of problems with that kind of testing. That's why we do it different, I suppose, is what can we do that's more objective than asking questions, right? Like I remember when I was concussed, my only, for sure, and it wasn't actually fully concussed because I played the rest of the game. After coming off the bench, I'm sure someone could, I could probably find it on YouTube. It was at the 2007 national championship for the NAHL, and I got hit, was wearing a half shield, normal hit, just kind of a bump, hit my jaw, and it was like literally the Tweety Birds. You know what I mean? Like everyone who's gotten like that, very mild concussion of just like, whoa, like Tweety Birds for a second, little head in the clouds, and then I got hit again from behind. The guy ended up getting like, I don't know if he got kicked out of the game for it, but I think he definitely got a penalty. But I was Bambi-legging, going to the bench. Team doctor comes over, does the right stuff. At the time, that was like what was thought was right. Ask me what the score of the game was. Like he followed what is taught at USA Hockey. Like I had to do the USA Hockey coaching certification for my son, and that was we had to go through concussion training there, and it's ask what the score of the game is, what period is it, where are you, what rink are we at, kind of ask what's your date of birth? Like try to find like, and just kind of looking at the person, and it's very subjective because it's like, just look at me, follow my thumb. Maybe there's nystagmus. Some people have it without being concussed, and
but if you don't baseline before the head's hurt, you wouldn't know if
exactly
nystagmus or some of those findings is due to the concussion or not.
Exactly.
And that's the half. I mean, that's kind of where the next question goes. So, we know the shortcomings are there. So if we were to, basically create a better version of it, knowing the research, especially with eye movements, posturography, and the shortcomings of the other, what would your ideal baseline testing look like? And then what would that, testing look like if there was a suspected concussion?
I think eye movements you can't cheat on, right? You can't lie.
What part of your brain's involved with them?
Every aspect. That's the crazy thing is
there's textbooks written on just the neurology of eye movements, and so you can't fake it.
Yeah, you cannot fake how fast you go from one position to a next. You cannot fake your way out of having a vestibular lesion.
Or how accurate you are when you go from one target to a next.
Yeah, there's how smooth your pursuit exercises are. There was an article done by the Carrick Institute showing like vertical eye motion and how it's impacted in just about anyone with a brain injury, but it's one of the first signs of neurodegeneration.
And it's eye movements. Heck, Parkinson's finger tap test between the eyes. Like, there's a lot of these aspects, and then too, when the frontal lobes go down or not as efficient, postural positioning, all those things start to can be picked up and quantified, especially if you know what they were before. It's not the scary part is it's not like these research articles on like the visual component to a concussion are new. Mm-hmm. They've been around a decade or and a half.
Yeah,
it's not like there's
really
one or two or three articles. There's hundreds of them showing the same aspect, and it's
and it's not like the technology's new either.
No,
like that's been around for a long time.
So what's that technology? Like how do we assess eye movements in our clinic then?
So there's a lot of different ways. VNG, VOG. There's the new device, the right eye, which is really cool. There's a bunch of different ways to understand someone's eye movements. The technology that we use, VNG, I think is the most accurate when it comes to concussion, in my opinion, because we can grade the smoothness of your pursuits, your ability to go slow motion side to side. We can look at head motion. So if we do any type of head motion where you turn your head side to side, we can look at your eye movements. But one of the important things is being able to look at your eye movements when you're in the dark. So when you have something and your eyes can't see anything, if you can't focus on anything because it's completely perfectly black, your eyes will tell you the story of what's happening in your brain.
Right, and so that's picked up by 2 infrared cameras looking on the pupil.
Yeah, people love watching it because it's like, wow, and it's funny because I don't know if you remember the first time that we did it.
Oh.
I was like, oh my God.
We may or may not have been hungover when we tested our eye movements the first time.
That's true.
And they were not great.
They were not great.
So we chemically concussed for a few hours.
Maybe chemically, but again, kind of goes to show you, like,
do we drink very often? No. Especially when you start to see what it does to the brain.
No. And,
we have a buddy we played hockey. Wasn't there, but heard he got in a collision, just playing pickup, and blacked out. And I'm like, you got to get in. Let's just check this out. Did a VNG, showed what his eye movements were.
It was crazy.
And he was like,
convergent spasm and like all these.
Couldn't inhibit like his initiation of a new eye movement. Like and
bouncing all over
him
the place.
Seeing that recording, he's like, I'm not going to skate for a while until this is cleaned up.
Yeah.
So it's such a valuable piece of it. So eye movements would be one baseline portion. What else would you include?
Posturography and basically even at worst doing one of the apps where there's a couple of different ones. We use C4 Logics, which is a technology that uses an iPad to determine your sway pattern. The technology in phones and
it's all in there.
Technology of phones and iPads is insane because it will measure very accurately your sway pattern when you have the iPad placed on your chest or in this app in particular, there's actually like a custom belt that the iPad clicks into, and it measures your waist sway, which is, I mean, as accurate as it gets. You don't want to measure shoulders, but measuring from your waist, that is your true sway pattern, and it measures it very accurately. And if you do that, and you can do it standing on one leg, you can do it standing with your eyes closed, you can do it with your eyes closed standing on like a foam pad. But worst comes to worst, someone should be able to stand on one foot on a foam pad for 10 seconds.
Especially if you think these people are either an athlete in high school,
absolutely,
or a college athlete or professional athlete. I mean, they have some level of physical performance that's already pretty good. So
considered better than it should be considered better than average.
Also, why it's important, like that baseline, doing it before they get their bell rung. So this is off season, free of any concussions, and then you can follow up that test. And again, they can't fake it.
Yeah,
it's really hard to fake those metrics.
Yeah, I mean, if you're concussed, you can lie on a sheet of paper, but if I try to stand on a foam pad and have my eyes closed, and you fall over, and it's like, listen, buddy, you can't play until you can at least do this.
So what's the foam pad do? Like, again,
yeah.
So just so we can, why that foam pad kind of sharpens the assessment of your awareness of space.
Yeah, the perception of balance and being balanced is really an issue. There's 3 sensory informations that need to go to the brain: your visual system, your vestibular system, these little canals and organs in the ears that perceive gravity and perceive rotation and linear forces on your head. And then there's proprioception. Proprioception is your brain's ability to feel your joints and your tendons and your ligaments and your fascia and all your connective tissue, giving information to your brain about where you are in space. Am I leaning on my left foot? Am I leaning on my right foot? Am I going forward? Am I going backward? Am I going up an elevator? Am I accelerating in a car? All that information is going to be perceived through those 3 systems. And as long as they line up, I always tell people, it's like, as long as they line up like an old school Mickey Mouse cartoon. Like, it's like you have someone who draws the background, you have someone who draws Mickey Mouse, and then you have someone who does like the color. And as long as those 3, like the thin plastic sheets, clear plastic sheets, line up perfectly, your brain's getting a beautiful picture of the world.
If it doesn't, what's your symptom maybe?
if one of those sheets just moves a little bit, you're going to feel potentially dizzy, off balance. A lot of people talk about vertigo. Vertigo is pretty rare, with the exception of benign paroxysmal positional vertigo. But typically after concussion, people feel more like they're floating on a boat. Mm-hmm. Okay, and that's a what's called a sensory mismatch between one or all of those systems, right? So your visual system.
So the foam pad, though, just before.
Oh, sorry. So the foam pad. The foam pad makes it more difficult to perceive where you are in space based on your proprioception.
So it forces more on the eyes and the inner ear.
Puts more pressure, it's pushing more pressure onto the ability to feel your vestibular input and your vision. Now, here's the ultimate test to your vestibular system, which majority of concussions are considered or have a vestibular impact. If you close your eyes while you're standing on that foam pad, you should still be able to stay up, especially if you consider like a high-level athlete. If this is a gymnast, you better believe they can stand on that foam pad with their eyes closed, no problem. But it's unbelievable how often people come in and think their brain's doing pretty good, and they try to do that. And then there's some people who come in and go like, I am not even going to do that because I know I'm going to fall over, and I know I'm going to fall over to the left. We have them do it for a second. They fall over every time. And a lot of times it's just a couple little stimulations, maybe rub their neck in the right place in the right time in the right way, maybe give them a couple of quick eye movements or do a couple little head motions to stimulate the vestibular system, and it fixes pretty quick a lot of times, not all the time, but pretty quick. And there's no drug to do that.
So talked about visual testing or VNG, some baseline testing for the visual system, your balance system or posturography. It doesn't take away your impact test, your paper test. I mean, those cognitive assessments are still valuable, but I mean, if you think about it, you have athletes that are going out to try to perform a physical task. it makes sense to start challenging actually the systems they're using out there, especially if say you are concussed and you miss some of these eye issues. So maybe you don't track well to your right. My concern is how are you going to see the person coming to hit you from that same direction? Are you going to get re-injured?
Mm-hmm.
And that's the other aspect to this is if you miss these little these kind of lines of care or these kind of impediments,
intricate details to concussion.
They're
for
impediments
sure.
to their function. I mean, one, they don't really get better, but then they also start to compensate. It's like, oh, now they have tension headaches because their eyes maybe aren't moving well, so they're just recruiting the neck to get their eyes to a position. And so this is why it's so essential to have a good baseline so you can have a good assessment at the time of concussion and really make a meaning out of that information.
Absolutely.
So
nailed it on the head, because it's yeah, a paper test can tell you someone may be cognitive, but you have to test physical ability, and eye movements, vestibular testing, and proprioceptive testing are the foundation, because those are the things that are primarily going to be visually, outside of the the neuropsychiatric component of a concussion, the anxiety, the depression. The absolute loss of the dorsolateral prefrontal cortex is pretty, pretty damning to these patients if they're not being looked at before and then tested for those things after.
Again, we don't want somebody to be down the road at 40 and having an emotional outburst when those things are.
Yeah.
These are the things that start to pick up on problems, and don't let the brain continue to age with these issues.
And it's interesting, these are the same tests that we would use for someone with
Stroke,
any neurodegenerative
anything.
disorder. Like, if we're concerned about brain whatsoever, these are tests that should be looked at no matter what.
Absolutely. And that's what you're going to. If you really truly want to assess the brain, you have to assess it in all its realms and functions and lobes, cerebellar to vestibular to ocular. Because again, you can't just, cognitive is really an assessment of mostly what? Frontal.
Yeah.
So it's not going and really tapping into some of your reflexive systems that are really going to be damning if you don't get those under control and catch that injury. So say you have a parent out there that's listening, or a parent in our office, what's a better way besides, obviously they can come in, we can do a baseline test, give them really good data, we can reassess if something happens. But there are other things. There's apps. What's your favorite app or kind of thing that they can be doing on a weekly basis just to keep their eye on them?
Yeah. My favorite at-home app is for sure EQ Brain Performance. It was developed by a Harvard researcher. It was introduced to me by the Carrick Institute, which is
where we got a lot of our
education
training
from. Pretty well known in the world of hockey and MMA and football, with helping a lot. Carrick trained providers helping.
Sidney Crosby,
yeah,
name it.
Russell
Wilson.
You name an NHL concussion and miraculous stories, and there's usually a Carrick trained functional neurology behind it. But the brain EQ Brain Performance app is really awesome because, number one, it's usable for all ages. I've actually let Porter play it a few times because it is a fun game. It checks your reaction time, which is something that is done on a lot of testing, checking reaction times. In our office we use the NSI, and it basically will pop up a blue button or pop up. It's basically NSI is a neurosensory motor integrator, and basically it's a big 50-inch TV touchscreen. It's basically a giant iPad, and things pop up, and it's kind of like whack-a-mole, but you're just using your fingers to touch these little targets that pop up, and it measures accuracy, and it measures your reaction time. Well, this is an app that you have on your phone that can test reaction time. It's a really fun game. The baseball pitch one, basically it's a standstill picture changes. As soon as the picture changes, you touch. And I've actually gotten in like little competitions with patients. Xander kills me on this one, and it's really fun little game. But it's same thing, it's same technology. You can put it up against your chest, and you can measure your sway pattern, and it's like this little football toss game, and it's pretty fun. It's all sports oriented. Anybody can do it. I have patients who are neurodegenerative using it. I have patients who are who get like anxiety using it. I have patients who have concussions using it. Obviously, any kind of head injury, any kind of stroke. I mean, we use it. People, if as long as you have the physical ability to do the test, it will accurately measure. And the other good thing about it is it's therapeutic.
It's
Like,
standardized.
it's standardized. I mean, it's billable in Canada.
It's billable and and then too, the nice part is, if you've gotten the app through us, it will also tell us, like, if your kid's coming in, does a baseline with us, they're doing this app week to week, and they get their bell rung, or you may not even see them get a hit, but you know they might have some small contact that caused a concussion. If they were doing this, you know, this fun, you know, these games throughout the week that are perceived as fun by them, but it's really actually giving us data, it can alert us if there's a you know, regression in their score.
Yeah.
And that could cue us like, hey, you know, maybe bring them in, let's assess, like, is there something going on? Again, catching it before it becomes a, hey, you already have a mild concussion that flew under the radar, and now you have a second impact syndrome, which is going to blow a concussion way out of proportion.
Absolutely.
And cause a lot more damage. And that's ultimately what you want to make sure it does not happen. You know, Miami Dolphins.
Yeah.
I mean, that's a concern when you start thinking of, like, it gets easier and easier to cause a snowball effect if you get concussed with it already rolling downhill.
Absolutely.
And so,
And the nice thing, like you were saying, coaches love these things, parents love these things, because until now it's been like, what do we do? Like, you know, do you think he's concussed? Do you think he's not concussed? Do you think she's got, you know, did she just get her bell rung? Like, what's going on here? Like, what's happening to this athlete? And now parents and coaches can have their phones with them and confidently go, okay, did you know, they did their baseline. If they play the games every day, because it's only a 5-minute game, like on your phone, everyone's on their phone for 5 minutes. You can do the whole set of games in under 5 minutes, and if you do it every day, you get a pretty good baseline. Even if you only have, I mean, one baseline test is better than zero, a lot better.
yeah.
But if they can do it every day, and they're basically showing a trend, and they've done it for weeks in a row, and then they potentially get a concussion when they're, you know, out of town, and mom and dad are sitting there going, what's going on? And the coach is sitting there going, maybe I don't need to play him, or was that a head injury? Or maybe he's a bad coach and saying, like, hey, you're fine, the worst thing possible. But, you know, now you can do that. It comes right to my computer. I've probably already been talking to them anyways, and they could say, hey, what if, you know, how we've let him play, it's been 3 hours, and we look at that. If it's showing significant deficit, then, you know, it's an easy conversation. You know, his reaction time's X, her trail making time is significantly slower, you know, unable to complete the app in general because they're so light sensitive or so noise sensitive. Or as soon as they start taxing their brain cognitively, you know, more symptoms come on. Those are classic signs of concussion, is when you start using your brain, it hurts more. So the app itself protects coaches, protects players, and protects parents, and gives you some confidence that you can make a, you know, at least an informed decision.
Yeah,
right?
And we have no financial kickback. To
Yeah,
this
there's
app.
no
It's
financial
more so
kickback.
there are options out there to give parents, just individuals, even if you are the pro athlete and you happen to hear this conversation, you can do this. And then again, if you want to take it upon yourself to have some metrics game by game, this is something that's very, very easy to
Unbelievably
implement.
cost effective too.
So I know we're kind of getting close for time here.
Yeah.
I think something that's incredibly important too. How long, you know, from a research standpoint, I mean, and before we even do this, most concussions are not necessarily a path. They're not going to show up on imaging, so they're functional lesions, right? And so, as functional neurology and functional neurologists, like, that's what our goal is to, you know, hey, the brain bleed's been ruled out, the hemorrhagic issue's been ruled out, the CT scan is clean, or you're not, you know, you don't even need to do it because the symptoms aren't bad, but function is decayed, and their performance is going down. That's one aspect, and that's really most of the concussions are that. There's just a decrease in function and performance, and it's never going to show up on an image, but it can show up on very, very precise and better testing. And again, if you don't make them perform on the testing in all regions of the brain, you're going to miss stuff.
Absolutely.
So that being said, let's say somebody gets concussed. You know, are they better? You know, is the the immune system and the neuroinflammatory cascade, is it better in 7 days? Is it better in 2 days? Is it better in a week?
After
to a
sitting
month,
in my
to
dark
3
room
months?
for
I mean, because again, there's research that goes through and looks at what your immune system's doing, and I mean, how long are the immunological changes going on in the brain?
So, symptom-wise, the research says most people will feel symptom-free within 7 to 10 days. Like
90%.
Yeah, 90% will have majority relief within 7 to 10 days. But the research shows the neuroimmunological cascade of this inflammatory response could last 6 months, a year, outside of a year. Most testing is showing us probably closer to a year, if not ever, unless they do the right therapy to get it firing back up. And that's why one of the things that when we talked about in the concussion fellowship courses were punch drunk, like the old boxers, old people who just got punched in the face a lot for a living. It was just kind of like a talked about thing, like an unspoken thing, I should say, is like in the community, just everyone knows around 50 years old, you're starting to slow down, and there's, maybe you become more irritable. And, when it comes to the immune system's reaction in the brain, it can continuously be going until something changes to stop it. And that's the problem. It can snowball effect.
I mean,
that's why they say it's like, once you get one, it's easy to get another. It's like, I would hesitate to say that from a clinical perspective, because I think, and we've seen it where people come in and are pretty messed up and they say, I'm feeling better now than I ever have.
Yeah.
Not just before, since I'm feeling better as good as before my concussion, but it's, I feel better than ever because of the changes that we made from from all the aspects that we treat it with, nutrition and supplementation and healthy living and lifestyle and breathing and everything that goes into
whatever your brain shows. I mean, whatever testing we do and it shows us your brain needs some help there, or it's going to have a metabolic impact on your brain, it's got to be addressed. If you're anemic, I mean, that's oxygen deprivation to an injured brain. That's going to impact in recovery time. So that's a lot on the recovery side. I think we knock out a podcast on, hey, you are concussed. We did a baseline test. It's on there. What labs, what should we be looking at? What could we be implementing? Do you go home and you eat like crap? Probably not. But kind of look at that part down the road podcast
for sure.
Next one or the one after this. We can add
gut, brain, gut. And we could. There's so many things to dive into when it comes to it.
Would you, going back through, obviously your son, he plays 8 years old, plays hockey. No issues with him playing a sport that is potentially.
I mean, of the people, and I've known thousands of people to play hockey that have made it out alive, right? Are better people for playing the team sport.
Yeah. I mean, physical exercise is one of the probably the most important thing. Sensory, moving and making your body continuously basically challenge itself in the environment and adapt continues to force your brain to grow, create new pathways, plus the circulatory benefits, the hormonal benefits, the metabolic benefits, which really, again, do what? Feed the brain. We all, the crazy part, we lose 60,000 neurons on average as we age, right? And so if we lose that per day, the goal is not to lose higher numbers of those neurons. And so if you get concussed, you lose some. How do you minimize the damage? Make sure you return at the right time. And that's really what the baseline testing, we have to improve and push, make better metrics on it.
And I think education, and that's what I was gonna say. Like on our website, we have a piece that's just for concussions, because it's such a big part of our office and a passion of our office. And on there, I talk about a research article that talks just about omega-3 fatty acid levels.
Yep.
Like testing omega-3 fatty acid levels the study was high school football players, and it was just like so drastic. It's like, okay, the kids that were lower in omega-3s in their blood were more likely to get concussed, and they were more likely to have prolonged symptoms. Basically, their symptoms last longer than 7 to 10 days. And then what they showed was that when you give omega-3 fatty acids, it works almost as a treatment.
Yep.
Like it actually clears things up even faster. So it just shows you that, brain health should not be looked at with blinders on. It has as much to do with your gut health and your nutrition and your nutritional nutrient density as it does, how good are my neurons connected, right?
Yeah. So I think we'll go even deeper into, from a metabolic side of things, are there labs that should be run, like he alluded to, the omega-3s. You can't be anemic going into a sport. I mean, that's going to impact oxygen delivery to the muscles, but your brain also uses the bulk of your oxygen intake. So again, you get concussed. That's going to slow down how well your cells recover and repair. So we'll knock out a whole...
Maybe that needs to be up close or up next, because maybe I need to be asking you some questions about the neurometabolic aspect of these things.
Maybe we will.
That would be a lot of fun.
Maybe we'll do that on episode 3 or 4. Anyways, I hope if you have any questions, this is purely meant to be educational. This is not any form of treatment. If you have a concussion, you suspect that you do, please seek medical attention from a medical provider. This is purely educational. If you're interested and you want more information on our office, or even like the app, EQ Brain Performance, in the show notes, I'll make sure to provide a link to their website so you can read up on it. But anything else you want to say before we head off?
No. Good luck out there with all your athletes, and keep your chin up.
Yeah, and parents or players, it's not to scare you off the field, but it's just really to make sure you're doing yourself justice and just getting the right baseline testing with all the markers of brain performance that could give you awareness of if a concussion's arise.
Absolutely. Be prepared, because as anyone who's played it, you and I laughed about it at the beginning of this. If I'm a parent and I want to be 100% sure we know what's going on, you have to have baseline before before it happens, and that at least then you have a wealth of information about what your kid's brain is like, or what your brain is like before doing it, and then you can make informed decisions instead of bad decisions.
Cool part too is you pick something up on that baseline test, like, whoa, your awareness of whether it's the right side or your eyes don't move well to one side, you can put in rehab or some eye retraining before you even get out on the field and make them a better athlete. They might see better. Now they don't miss the passes from this side of the field.
There's a whole nother podcast right there.
The podcast on
not
brain
just
performance.
Not just what happens or how can we prevent or whatever, but how can we be a better athlete?
Tapping into it.
We see this all the time, like not just in athletes, but like kids, like can't read. My kid's dyslexic. My kid's this, and it's like you do that same VNG, that same test, and it's like
their eyes can't track.
It's not that they can't read.
Function.
Yeah, it's not that they can't read. It's that they can't even move their eyes. How can you expect to? If you have no stability, you have no eye stability, no ability to keep your eyes still. That's but that's a whole other podcast.
Time. Anyways, this is the end of episode 2. Hope you guys enjoyed it. If there's some rants in there, but hey, that's us. If there's any other episodes or topics you want to hear, please comment, subscribe, share to anybody you think that would benefit from this, and we'll see you next time on episode 3.